I'm here to give you information, some insight, and I'm here to help. Foot care from the doctor who cares. That's my motto.
I'm Dr. Maasi Smith, surgical podiatrist. I've been in practice in the city of Philadelphia for over 10 years.
My feet hurt so much we decided to bring in the good doctor, Dr. Maasi Smith.
You know what, this is the main culprit. Unfortunately, we have to show all women's shoes because 90% of surgeries I perform are women. I mean, you have to understand I'm a foot doctor, so I see the worst of the worst. And I've written prescriptions for years, different prescriptions for different type of ailments. And what I've noticed is a lot of those don't work. I have tons of patients that come back to me and they say, doctor, you have something better. So it came to me, why not develop something better?
You gotta realize when you walk 7,000 to 10,000 steps a day, the average person does, that's called microtrauma on the feet. And if you don't have any shock absorption, that can be an issue.
The feet are a bath of nerves. There are specific places that you can touch on the foot that would actually, we can say, get the mood right, around the ankles. People don't realize how much of an erogenous zone that is around the ankles. And soft strokes around the back area of the ankle. This is done with oils and creams and just lightly massage.
You notice there are a lot of products out there, but they'll have one. They'll have the soy, they'll have the aloe, or they'll have the vitamin E. So what I decided to do is talk to a laboratory, a natural laboratory, and say, look, we need to develop something that my patients as well as other people could really care about and really understand that it's a natural product that they're putting on their skin, and there are no harsh chemicals.
The children's foot is constantly developing, so it's important to measure your kid's feet every time you get them a pair of shoes.
What do you mean? How often would that be then? Every time you get them a shoe, measure it again?
Honestly, yes.
Just yesterday, I had to schedule a patient for an amputation. People don't come in when they first see a problem, and I've had this, and I've seen it increasingly, especially being in South Philadelphia, that people come in at the end stages of something. Right. And what I'm trying to do is just educate the public. And if you see the spots, if you see the edema, come get an evaluation.
Everybody walk your body. Everybody walk your body.
Most days they get us where we're trying to go, but sadly our walk isn't always pleasant.
People don't think of the feet as important. The feet don't become important until they hurt.
Itch.
Make it fun.
Or even smell.
Odor is basically from excess moisture in the skin. Between the 2 feet, you have over 500,000 sweat glands. A lot of people don't realize the number is that high.
Or know that the foot produces a fluid that results in bacteria developing on the skin. That causes the odor.
It's been called many names. It's been Limburger cheese.
One Limburger cheese sandwich. One Limburger cheese coming up. Right. Limburger cheese.
It's been corn chips. One of the ways you combat that is just try to keep the skin clean and dry.
The doctor says you can also try using pads or inserts in your shoes made out of charcoal. That absorbs moisture. And another issue people have to contend with?
Fungus is an opportunistic organism. You know, some people get it, some people don't. It all depends on the structure of your nail as well. Fungus breeds in dark, moist areas.
Places like the inside of your shoes.
Usually turns the nails black, brown. I mean, it could be bacterial, it could be, which can cause a green tone to them. Athlete's foot is very prominent when somebody has nail fungus. And then sometimes they can have, and sometimes the fungus can smell too.
Smith suggests treating the condition with medications prescribed by a doctor, like Lamisil or other over-the-counter topical antifungal creams. But if the nail is really, really thick or showing signs of damage, it will sometimes require a more intense remedy, such as laser treatment. And then there are ingrown toenails, which surprisingly is very common according to the podiatrist.
Some can be real moderate and some can be real severe. When that nail goes into the fold of the skin, what it does, it pushes up the flesh a little bit. It kind of causes an infection and usually has a little abscess there.
Or even an infection. While it is very prevalent, the doctor says it is also very easy to treat.
We just give a little local anesthetic, use special instrumentation, and just remove the nail. Typically, it doesn't cause a serious issue unless somebody ignores it for a long period of time.
I'm looking forward to the opportunity to really reach a wider audience, whether it's a product endorsement or talking about innovations in foot health and foot care, whether it's radio, whether it's TV. That's something that I truly enjoy and I look forward to doing it on a daily basis.